that the way it's being counted at the moment means that if you are diagnosed, you test positive for coronavirus, even if you go into hospital, but then you recover and you come out, and then 2 months later, say, or a period of time later, you then die of something completely unrelated to coronavirus, your death will still be added to that coronavirus death tally. So the example that was given to me by a government source was basically if you had tested positive in February for coronavirus, you'd recovered, you'd been fine for the last few months, but then you'd been hit by a lorry or hit by a bus yesterday and died, your death would still be added on to that coronavirus tally, even though clearly, even though you may have had it, clearly your death is nothing to do with coronavirus at all.
You were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
Hospital death rate and the total death rate. It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference. The hospital death rate and the total death rate. It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
These are ways that they've exaggerated the death toll and overblown it in order to put all these draconian, authoritarian measures upon our lives. But now, this is one of the most twisted ways that they inflated the death figure, because there are real deaths in that figure. People have really died, you understand? Now, let's say that COVID is real, because I'm not gonna say it's completely not real. There's a new coronavirus every year or two, there's a new flu going around, you understand? I'm not gonna deny that. So who dies from the flu is the elderly, right? So in the height of this flu-like pandemic, or so they call it, look at this now. NHS managers told care homes to put blanket do not resuscitate orders on all residents at the height of the COVID crisis. So the people who are the most risk of dying from this kind of illness, they intentionally did not resuscitate them, meaning that the young people who are not at risk from COVID, the 15-year-olds, the 25-year-olds, and the 35 and 45-year-olds who are not really at risk of COVID, that in order to save space for us, that's the logic they use, the people who are most likely to die could not receive treatment and were left to die. Now, you NHS workers should be ashamed of yourselves. Care home staff said that during the height of the coronavirus crisis, hospitals were refusing to admit residents from care homes. The orders mean doctors will not attempt to restart a patient's heart with defibrillators or with CPR and will be allowed to die if it happens naturally. And then that person who could have been saved will be added to the COVID death toll. It's shameful.
Certain groups can be more vulnerable to the virus, such as those with underlying problems like heart disease and diabetes. And age is a major factor too. Take a look at this graph showing mortality rates from known cases across the world. At the very far end are the older age groups, and you can see the taller groups and the taller bars representing the higher rates of death. But as you come this way, towards the younger age groups, the bars get smaller, quite dramatically so, and that shows the vast majority of younger patients survive.